Good morning, good evening, ladies and gentlemen, wherever you are in the Eastern United States or wherever you're actually listening to this. This is Labour weekend, and myself and Dr. David Krause has jumped on here to cover something really important. Because as you know, if you've been listening to our discussions and some of our episodes, we rely heavily on exposing potential issues to do with Legionella and pathogens and unknown pathogens and things like that. And obviously, if you have been watching the news, you'll know that there has been a serious outbreak in Harlem area in New York. But we're going to dive into some things today because there's assumptions abound. There is ignorance that is being played out. There is lives being lost, and we just need to jump into this. David, good morning. How are you, my friend?
Good morning. I'm really glad to be here and to delve into some of the issues that are coming to light at this point.
You know, you sent me some articles. We've been keeping on the news. We've been watching this very closely. And it seems to me, I mean, again, just before we came on here to discuss this, the irony that this is the Legionella is in a hospital now, an emergency, an EMS station, and to make matters worse, public health laboratory that is being constructed. Now, whether people will say, well, this thing happened, and then we have assumptions where they say that everything was covered and that they were compliant, and this happens because it's natural. But in reality, David, it may have a natural foundation, but this is not natural, and this is dangerous.
Yes, of course. Well, I'm a bit surprised because in my past experiences with dealing with outbreaks, it is again the role of and responsibility of public health officials, typically at the state, county, in this instance, New York City, to investigate those outbreaks. There has been, in my observation, a reluctance to look at or seriously consider government-owned buildings, being whether they're federal, state, county, local facilities. Um, so there's usually they're not even tested to begin with. Here, I think the pressure and the epidemiology and the need really drove it. They had indicated that, well, this is New York City. We have the most rigorous cooling tower regulations. We have requirements for registration. We have requirements for testing. And guess what? All of that didn't make a difference. So you can have regulations, and in many instances, complying with the regulations, either on paper or in reality, does not manage the risk and does not ensure safety.
I want to talk a little bit about also, David. They have claimed it's come from two water cooling towers. We've discussed this before, ladies and gentlemen. You can go back and listen to some of our discussions. But there's an assumption here, and the assumption is, and it almost seems like to me, in reading between the lines, it's like, it happens. Let's, crap rolls down a hill. So these are the things that this is a natural disaster, which we know it's not, because the minute that we introduce man's man's needs, or changing the environment in some way, or bringing water into systems that are built, it's no longer natural. Where do you think this? I find it just not even plausible how they could come out and say publicly, "Hey, this happens. It's natural," when
Yeah,
people are dying.
yeah. That's it's a fallback position to say, well, there's nothing we could have done about it. And it will be interesting to see as more and more information, historical information, is brought to light as to whether something could have been done and what they were actually doing. one of the biggest factors that I've always said with that's a problem, is a fundamental flaw uh, with the cooling tower regulations in New York City, is that the entity, whether it's the owner or the cooling tower treatment company, cooling towers have to be treated with biological agents and anti-corrosive agents on a regular basis, ongoing basis, continuously, in order to keep them from becoming, either corroded entirely and dysfunctional, or to from growing bacteria to unhealthy and dangerous levels. But the New York City regulations, as well as the absence of any regulations across the country, implicitly and strictly allows for the contractors who are responsible for maintaining those systems to collect samples that are used to validate the effectiveness of their own work. And this creates a disincentive to effectively evaluate and monitor and detect contaminants and contaminant conditions early. Essentially, you're asking them to grade their own homework. And we don't do this in any other type of environmental investigations where we're dealing with asbestos, lead, radon, mold. You can't grade your own homework, and you cannot expect good outcomes when you allow this to happen.
They've also said, I noticed as well, that they said, you know, the towers have been, as you mentioned, that has to be treated. Okay. Now they're kind of holding their hands up and said, hey, we've remediated the problem. It's gone. We've taken remediation steps. Cooling towers have been treated and it's all good. But yet, it's like the horses, that we've opened the door, the horse is bolted, there's nothing you can do about it because it's already in the system. Because now we have an outbreak within the emergency medical services unit in the hospital.
What they've got there, they've reported that they detected Legionella in the plumbing system. They haven't reported any disease related to that. However, it's not uncommon for us to miss that type of diagnosis. The arrogance with which they say, "Oh, the cooling towers are disinfected." Period. They didn't say that the cooling towers have been disinfected, cleaned, put back into operation, and tested, sampled, and gotten results back to ensure that they do have non-detects. It is
Yes, it's somewhat
commonplace.
arrogant. It's somewhat arrogant in the way that they've come across with this.
The simply stating it has been done, show me, because I frequently see remediations fail to achieve what they need to achieve. I frequently see them actually even increase the concentrations of bacteria. So just publicly saying it's been taken care of, don't worry about it, is nonsense.
The public health lab that is being built, the laboratory that's being built, obviously that is I'm flabbergasted with that, because even though it's under construction, let's talk a little bit about that, because that's another seems to be an excuse. Well, because we're building it, there's construction in, we're making it possible for Legionella to colonize,
Huge
and this
risk
happens
factors.
because it's natural.
Yeah, huge risk factors that are beyond the control of the building operators, owners, or the people who have the water management plan, have to be acknowledged and dealt with. So, you know, if you look at the maps, photographs of that area, there's been construction going on that block, on that hospital, constantly, not just that 10-story building. And the irony is that it is intended to be the public health laboratory and probably will be running samples for Legionella in the future. But that can happen with any construction. Any long-term construction can cause the disruption in the water mains that increase the levels of Legionella. You also got there was one study that looked at numerous outbreaks, and they concluded that 35%, over a third of outbreaks that they had evaluated at the CDC, were caused by or had a major contributing factor due to external disruptive factors such as construction. And I've seen this in so many instances as well. So when you have nearby construction that is impacting your water mains, that is a huge factor you have to take into place, and increased surveillance has to occur, or you can be receive a nasty surprise like this. The other
Yeah.
thing is the massive rains that happened July 15th. The New York City experienced record level rainfall in in a single 1 hour period. They received 2 inches of rain. What that does, these open top cooling towers, they're exposed to the atmosphere and they get overflooded. They overflow due to excessive rainfall. That rainfall dilutes the disinfectant chemicals that are in the water. Once that happens, it allows for the rapid amplification of bacteria, amoeba, and introduced bacteria from the makeup fill water from the municipal water systems. So it's kind of a 1-2 punch. So these factors are not discussed, warned, published, talked about in public health, and they're entirely foreseeable. I think cooling tower operators recognize it, but often they're limited in what they can do or recommend, or because it takes time and money to manage those issues. The other big factor here is New York City was holding on to data for 2 weeks, 10 to 14 days after they had collected those samples. The average onset of time between exposure and symptoms is easily 5 to 6 days. So
I was going to say it's about a week before for it to develop. And
yeah, it can be 2 days, it can be up to 14 days, but the median time is 5 days. So if that's the case, if you look at the distribution curve, the epi curve on cases, that means if they had positive results on July 25th, they would have had that they collected on July 25th. If they had gotten those results, that they had positive culture results for Legionella pneumophila on July 27th, they could have and they should have taken action rather than waiting until well into August to make any statements or requirements for, I think it was August 7th that they required them to actually disinfect the towers. 30 additional people contracted Legionnaire's disease during that period, which may, 1, 2, or 3 deaths may have occurred from that. So
the numbers are continually going up, David.
Well, they're reported to be going down, but understand who's reporting them. It's the New York City Public Health Department. They are intrinsically involved in this. They are the investigator, they're the judge, they're the laboratory, and they're going to be the jury on this. We have to recognize they are in an impossible conflict of interest, and they need to step aside and open up their books and their processes to allow transparency. Otherwise, anything they say is going to be seen as self-serving.
It seems to me that it's pretty much self-serving at the moment. I want to jump back a little bit as well to the construction side of things, because that seems to be an important issue. And from what I'm seeing is that there doesn't seem to be any guidelines in construction, because it is a massive threat. This is how it gets introduced, during construction phases, sediment in the water, etc. But I mean, there doesn't seem to be any guidelines or testing. The construction companies don't do it.
That's the problem. They do. There are guidelines. The Facilities Guidelines Institute, which is updated every few years. It is I'll say the Bible for constructing hospitals. But if you're doing a building next to the hospital, it doesn't apply.
Oh, okay, right. Okay, so the guidelines cover the hospital side, but any outbuildings or any other,
or
such as a laboratory or something, no.
Exactly, they're not covered by that, and the hospital isn't required to take any actions during that period to deal with with disruptions in its water mains and water service. The other thing is, New York City has been hyper-focused on outbreaks and disease caused by cooling towers. If you look at the rules and regulations, you would look at it and assume that's the only way anybody can ever contract Legionnaire's disease is from a cooling tower, and we know that's not the case. We've had in the past 10 years, I've probably dealt with a dozen different outbreaks in legal matters related to plumbing systems, municipal water systems, in apartments and hotels. So this is, a frequently recurring event. Yet in this instance, they are acting as if the cooling towers are entirely separate, not connected, not served by the same water system. And the truth is, the
Yeah.
municipal water system that is used to supply water to those cooling towers in thousands of gallons a day is also the water that goes into the EMS station, the hospital,
Yeah.
the as well as the across the street at the 65 plus Alma Wrangle uh,
You mentioned
housing
that,
unit,
which is a
which is
high threat.
literally across the street. I mean, they require people to be 65 or older, so they inherently, by definition, have a high risk population.
And there's probably people in that community that are immune compromised.
By definition, they are. By their
Absolutely.
age, they fall into that high risk population. So those people are and have been, and many of them may already have contracted it. Public health doesn't release the names and addresses of the individuals who contract the disease, but they try to
Let's just remind people that might who may just be jumping in and haven't listened to a lot of let's just remind people that how the path of infection actually happens, because a lot of people might not understand this, because we've got it coming from the municipal water supply, but how do these elderly people, immune compromised people, or even people working in the area, how do they get the Legionella? How do they contract it? What's the path to
absolutely, absolutely.
contraction?
Well, all right. So we say for decades, it's been stated that Legionella is an opportunistic pathogen that attacks people with compromised immune systems. Now, those individuals would have a higher risk, but it's not that much higher. In an outbreak such as this, we have construction workers who contracted Legionnaire's disease.
Yeah, yeah.
Fairly healthy working population. The pathway of exposure is via inhalation of fine water droplets, inhalable water droplets that contain the bacteria. In a broad, widespread outbreak such as this, we're dealing with community-wide impacts, and it does have the signature, the pattern of a cooling tower outbreak, but it's not just cooling towers. Any water system that has become colonized or seeded and began to grow and amplify this bacteria and then allows it to aerosolize has to be considered a possible risk. So while the cooling towers may be the main source where it spews this fine mist out into the city streets, it's not the only source. And treating it as such really does a disservice.
One of the things that I find remarkable is how public health will brush under the carpet the potential threats of exposure. It seems they might have a guideline out there, but they brush under the carpet the potential threats, especially to our elderly communities or veteran communities, this community that is right next to the hospital. And, at the end of the day, we have to look at, well, who's to blame for this outbreak? And you might not be able to answer that, but really there has to be a foundation. Look, this is your responsibility. You're to blame. You're brushing this under the carpet. You're making wild assumptions, and we're not getting to the root of the cause here.
Well, that's been a tough one. That's been a tough one. In my view of the world, there's two aspects to this. There's the authority and there's the responsibility. Who has the authority to investigate? Who has the authority to implement rules and laws, regulations to prevent? Who has the authority to stop work or to manage, treat the water systems? That authority is predominantly vested in the public health agency, New York City Public Health, the state public health agency, and the Centers for Disease Control and Prevention. They're the investigators. They have the authority to give those investigations, but their authority to issue rules, regulations, requirements, enforceable items at the federal level, it is strictly it's guidance. It's a good recommendation, and some of the recommendations are flat out wrong. So there has been
And I find it so ignorant that it's the way that it's passed over is just a guideline. It's a recommendation. You don't necessarily have to take action upon it, but we would rather you did. And then look what happens.
Well, that's how public health has operated in this country for a long time. Very few.
So wrong.
Few
So
exceptions.
wrong.
Well, yes. Well, and then we have outbreaks like this that show that that system is far from perfect and still allows for massive numbers of people to become ill and die to preventable disease. The responsibility ultimately lies on the persons who own and operate those buildings, and that may or may not be appropriate, but in our legal system, that's where it ultimately lies. They may not know about this risk. There's no requirement that they perform these risk assessments. There's been efforts to implement them, but it hasn't happened. And frankly, with the water management plans, the way they're laid out under ASHRAE 188, they're not 100% effective. There's no guarantee that they work, and they've never been demonstrated to actually reduce the risk of Legionnaire's disease in large populations. So it seems like a good idea, but it hasn't proven worthwhile. And I say that simply by looking at when ASHRAE 188 was published in 2015. The number of outbreaks since then has continued to rise. So if it was working, then we should see a diminution in outbreaks and cases. And we haven't seen
But we're not. We're actually seeing an increase. In actual, ladies and gentlemen, we've actually did some, and I'll link it below. We've done a few other episodes which you can go and listen to or watch, where we actually go into the reasons of why these are increasing. It's very interesting, and you can actually start to see that pattern, and this pattern coming full circle.
Yeah, a separate study that CDC did on 14 separate outbreaks. And this was published. We can provide a link to that article. And one of the aspects they didn't bring to the attention of the reader or call out in their conclusions was that these facilities were just as likely to have a water management plan as not. Meaning that if you had a water management plan, or if you didn't have a water management plan, you were the same number on each side of that had outbreaks. So are they protective? Is it just a flip of the coin? Are the water management plans missing some key critical aspects, such as
That's what I was going to ask. That's what I was going to jump into, because you can have a water management plan, but that water management plan may not be enough. I mean, it may not cover.
Oh my gosh. I've been retained on another case recently in which a facility had a 5-page water management plan. 2 of those pages were simply a plan to create a plan. It was the most infantile, ridiculous plan I've ever seen. It was ludicrous. And yet it survived for 7 years without being called out.
It's crazy.
And then they started actually seeing increased number of results, positive sample results for the pathogenic form of Legionella, and they did nothing about it.
There's no. Correct me if I'm wrong, David, but there's no legal requirement for anywhere to have a water management plan, is there?
The only, I'd say, pseudo legal requirement is for hospitals and long-term skilled nursing facilities to have a water management plan.
But you're saying a pseudo legal requirement, so it's not tight then.
It's not based on a law. It's based on a memorandum from the Centers for Management of Medicare and Medicaid Services, published in 2017, and that's it. That's the entirety of it. They reference a requirement to have to avoid healthcare acquired infections. They point to Legionella. They say you should do it in consideration of ASHRAE 188, and then they call out specifically, this requirement is not telling you have to actually collect samples for Legionella, which is basically saying don't look. And if this facility that I'm referring to had not looked even on a minimal basis, which was an inadequate amount of samples, they still wouldn't know.
Looking at this case, David, looking at what has happened, the proliferation of the disease, within, within Harlem, from the medical center, the construction. What is the potential consequences, both legally and at a local level, within this case now? Because we've had so many deaths, there's been so many people that have contracted it. Where are we going to go with this? What's the potential here?
Well, I doubt anything is going to happen in the short term that benefits this. New York City is probably going to make some changes to its rules, but I don't see that they're necessarily reaching out to experts. They've been fairly insular in their approach. Those rules will probably, uh, from what I've seen, that are being proposed, will just create build more on a flawed foundation. They're still not preventing the treatment companies from taking their own validation samples. They're still not requiring third party validation. One of the things you got to realize here is that the reporting system for Legionnaire's disease, as a when a person contracts Legionnaires, requires that both the laboratory that detects a positive result and the physician or hospital or clinic that that diagnoses that patient both have to report that condition and that finding to the state health office or to the county health department, which then reports it to the state. We don't have that requirement for the environmental testing. If you did, if you had a requirement that that third party investigator had to report it not just to the building owner, but also to the state or the county health department, and that the laboratory that diagnosed it had to report it directly. You can
Yeah.
bypass the nonsense that does happen where those data sometimes just find their way into the circular file and never make their to the light of day. There's no requirement that anybody has to report anything. And so a report that I may publish and give to the client, I can assure you isn't being sent up to the state. So,
Should
if
it
they don't
should
fix
it
that
be
problem, the rest of
should
this is just, lipstick on a pig.
I love that. Should it be a requirement as well for construction companies to get into the habit of having to have regular testing when they're doing anything to do with healthcare, or any major construction for that matter?
That right now, that just depends upon the contract in place. So there's no rules or requirements on it either way. The plumbing systems, we've had brand new hospitals have outbreaks due to Legionella growing in their plumbing system during construction. Cooling towers, they're a odd piece. They come online and they may or may not be operating for most of that construction period. So, whether there's right now there's not any requirement, and should there have been, I think that there was a big gap in the regulatory
Massive, yeah,
framework, and unless it
yeah.
was spelled out in the contract for that facility to pick up water, as soon as you have water in this system, you've got to start testing and monitoring and treating and ensuring that it's safe. Right now, it's a big gap in the protection of health and safety, both to the for the contractors and for the communities.
How far can this spread, David? How far can this case in Harlem? Because obviously we have an at-risk community that's in the local area. We have the construction going on. The water towers, obviously they've been treated, but it's already gone into the water supply. How far can we see this case spread?
Well, the public health department, the New York City Public Health, has deemed it to be over. They declared it done. They're done. There's additional cases up in the Bronx. There's additional, and I can assure you, during this outbreak, there were probably cases outside of Harlem that were being reported that were excluded from the 5 zip codes. So, the putting that hard boundary around it and a beginning and end date, that is what public health agencies and epidemiologists do. Um, so they're going to declare
Is
this
that really a
over.
good move? I mean, can you really just say it's over when you don't really have, to me, you don't really have the empirical evidence that it's over because it's still potentially.
Well, according to the epidemiologists at New York City Public Health feel that they have the evidence to do that. They've stopped receiving additional cases. The irony is that they're going to say, well, it's because of the actions we took. It's because of we stepped in and did this. And you know what? Whether they stepped in or not, the outbreak would have ended.
Yeah.
We saw that in Flint, Michigan. Looking back, the
Yeah.
outbreak they had in 2015, and then they look back at 2014, and they had the same outbreak. It spiked, it peaked, it did its thing, and it went away. And that's what happens everywhere. I've always said that I think 90% of the time public health intervention is at the end of it anyway because of the lag between exposure and onset of symptoms, the lag between diagnosis and reporting, the lag between samples collection and analysis. I mean, you've got 6 to 8 weeks in there sometimes. And so a lot of the times I think they're just patting themselves on the back that, hey, look what we did, and it was going to happen that way anyway. It's like
Yeah.
getting the flu. You're either going to recover or you're going to die. Most of the medicines you take for it, they did not stop the flu.
Yeah, it's like putting a plaster on something, temporary plaster on it, and then claiming, hey, we put the plaster on, so we did the job right, and that's the main.
So
We're
surveillance and prevention are the things that need to happen at this point.
and that's what I was going to ask you. We've had a lot of cases. We've talked about this many times before, you and I. But it still seems that we're at this stalemate because it doesn't seem that anything really is changing. Yet we're still getting increased exposures, we're having increased outbreaks, but nothing seems to be changing. Yes, I mean, we're moving forward in HC3 doing education and trying to move forward on that side of things, but nothing at the state level, nothing at the federal level, nothing even at a local level is changing.
It does not have priority. Not the bodies have not stacked up high enough for it to reach national priority. The US EPA still refuses to add Legionella pneumophila to the list of contaminants in public water systems that it has to test for and report. Municipal water systems are blind to whether they are an ongoing source of Legionella to its users. The users don't understand the risk that they're at. There's no requirement to do a risk assessment, though there are some recommendations. And frankly, there's no certification and credential to ensure that those who do the risk assessment are qualified, competent, educated, certified in doing this. And until you put all those pieces together, even if you require testing, if you don't require the testing be done in an effective, safe, reliable manner that's repeatable, if we don't improve the test times, right now we're still at the same turnaround time for Legionella samples as we were in 1985. 2 weeks, 10 to 14 days before you get results. And you cannot go down this nonsense of testing for both live and dead and then trying to unbake that cake after you've said we found Legionella, but oh, by the way, 90% of it was dead. New test methods are available. New test procedures do allow for shorter and shorter time periods. So that has to happen. And a requirement that we test from the point of the municipal water system, test in the high risk buildings, test in the high risk community exposures, and further research needs to happen in order to understand the litany of sources that people are exposed to and how to control them. So we have a long way to go.
We do have a long way, but what's exciting, and this is something, and I don't want to jump into it too much here because it's another discussion that you, myself, and probably Robert is going to talk about, because we do have more testing. We have got breakthroughs that we're working on, and that's another discussion that we're going to have. So make sure, guys, that you keep watching and connect with us, because we've got big announcements coming up. But what would you like to see from not only construction companies that are involved in this and healthcare organizations and companies? What would you urge them, David, before we finish off? What would you say to them now to be more proactive than reactive? What can they do?
I think the one thing that has been said from the New York City Public Health Agency in their recent press release is that they deemed that the facilities at the Harlem Hospital and the adjacent construction of the New York Public Health Lab were in full compliance. They were not out of compliance. So that clearly is a clarion call and a very bright light that compliance with the rules does not manage risk. The second thing is we've got to start treating surveillance of environmental sources of disease with the same or more seriousness as we do surveillance of diagnosed disease in patients. We know diagnosis of patient Legionnaire's disease is probably in the 10 to 15% effectiveness, in that you're only capturing 10 to 15% of the actual number of cases. If we can do better than that on the environmental source front, and we can do that in a fashion that allows us to sample before it makes people ill, now we
Yeah.
have the chance to start really managing risk. And then the whole surveillance and reporting requirements, moving that into an electronic version, a requirement for testing and for reporting, not just a convenience of testing, and separating the testing from the treatment so that you have a third party verifying those results who's not disincentivized or putting themselves at risk if they report bad results.
Dave, I want you to, if you had a chance now, before we finish here, what message would you directly send to the New York Public Health Department?
Reconsider your entire program and look to make changes regarding surveillance of environmental sources, certainly for cooling towers, but you have to look at the municipal water system and the belief that Legionella gets into these cooling towers in some fantastical fashion that is outside of the water that is supplied to it has to stop. You have to acknowledge that water contains, albeit low levels, hopefully, it is the source of the bacterium that then grows when the conditions within the man-made systems allow. So understanding where it's coming from can help people understand the magnitude of risk that they're actually at.
David, thank you for being with me again today. I think this was really important. Ladies and gentlemen, as we've said many times, connect with us if you've got any questions. If you're worried, if you are an operator, a construction company, and you're potentially worried that you're getting into a project, then please reach out to us at hc3fl.com, connect with David, and he'll be able to help you through that. But be aware, ladies and gentlemen, that this shouldn't be swept under the rug. And the more that we become proactive, the more that corporations, the more that we have a bigger educational voice out there as well to educate the public, not only at leadership level, but at local level, that perhaps maybe we'll get some of these changes. Make sure you connect with us. Make sure you catch up with all the other discussions. We've got plenty more discussions coming up. And the next one, we're going to be talking about a very important breakthrough in Legionella testing. So, David, thank you for joining me this morning.
Thank you.
Ladies and gentlemen, have a great holiday weekend. If you're listening to this afterwards, then we hope you've had a great holiday weekend, and we will be back in touch with you all again very soon. God bless.